Hi, good morning. My name is Claudia Austin. I've been a patient at Synchrony for 9 months. 9 months ago I got my lap band. And what made me decide to want to do it was because I'm 65 years old, which is way too old for this procedure, I understand, but I've been overweight for many years and was beginning to look at diseases of obesity that were going to be on my plate that I did not want to be on my plate. Things like hypertension and diabetes and heart disease and osteoarthritis and sleep disorders, and I knew that was coming to me, but I didn't want that. So I had tried many diets, as I'm sure most people have who've been overweight, and they all worked for me for a short period of time, but now the weight, I had gained so much weight over the last 20 years at a very slow rate, 3 pounds a year for 20 years or 4 pounds a year. And I did not have the desire to go back to one more weight loss program. I just could not do one more. At the age of 65, I could not do one more weight loss program. And that's why I decided to use the band, because for me, I see the band as both preventative and curative. I wanted to get those things off my plate that I knew were coming down the road. I was already having trouble walking. I was limping. People were asking me if I needed a knee replacement or a hip replacement, and of course I don't, but the limping was very obvious. I could do very limited amount of exercise. Sleeping was I was having sleeping problems. My cholesterol was very high. I had to take a statin for my cholesterol, and so I knew that the time had come to do a permanent change, because at the age of 65 I don't have 20 more years to lose the weight so that I can then enjoy the rest of my life. That rationale doesn't work for me anymore, and that's why I chose to have the lap band procedure done. Well, I started out with a consultation by Dr. Watkins. I came in for a personal consultation, and after talking to him, I realized that this procedure, that I could do this procedure, and that this could in fact be a lifetime change for me. Well, I don't eat unless I'm hungry. I'm not a nighttime eater. I don't look for food if I'm not hungry, and so having the band it makes me not hungry, and for that reason I don't eat, so that I can cut down the volume, because my problem was I was eating a very healthy diet, but it was the American way, which was huge portions. And with the band, of course, I eat very small portions. I eat 3 small portions a day. I don't cook in huge portions, which has been another huge change for me. I cook small amounts, I eat small amounts, and it's the band that allows me to do that and not be hungry, so I'm not looking for food in between meals. My pants got longer. No, my most rewarding benefit really has been to be able to stop the statins. I no longer have to take statins for my cholesterol. My cholesterol is perfectly normal. Well, now I can walk a 5K every day, and I enjoy walking, and I could not do that before surgery, not at all. Well, the hardest thing for me is to go back and get the band adjusted when the weight loss starts to taper off. I'm still in the diet mode of having to go back to meetings or get weighed in, and feeling bad because I haven't lost any weight during that period of time, and so it's a shift. I'm creating a shift in the way I'm thinking, to be able to go back and have an adjustment on the band and not have that be a negative, but have that be a positive experience. Well, I think it's the lifetime support at Synchrony. I looked at many band programs on the website before I chose this one. I called people and talked to them about their programs, and anybody can do the surgery. The technique is there, and there were many surgical sites where I could have had the actual surgery done. But I see this as a lifetime change for me, and so having that lifetime support there is the most important thing, because it's not just about the band. It's about the whole paradigm shift. Don't think you're too old. I'm keeping up the average age. And I think if you really want to do it, it will be wonderful for you. For me, there have been no downsides. There's no downside to it. There is no. I feel good. My nutritional status is excellent. My energy is up. I'm not limited in, what I eat or what I do, or really there is no downside. So by all means, look into it. Do your homework, go to the websites, read all about the band, and then pick the program that is best for you. I needed an outpatient location. I did not want to be in the hospital overnight. I needed someone who would help with the insurance, whether or not my insurance paid, but would follow up on that. And I needed the lifetime support. And I also needed a surgeon who was trained to teach other surgeons, and did a certain number of surgeries every year, so was well qualified. And all of that information is on the website and helps you make your decision. But I would strongly recommend it. Go for it.